today. I'm Dorian Warren, Vice President of Community Change Action. We're a national organization that builds the power of low-income people of color to fight for a society where everyone can thrive. Now, we at Community Change Action are excited to be here today with our firm action partners and with our champions on the Hill who are joining us in their leadership capacities. So welcome to Congresswoman Chu, Chair of the Congressional Asian Pacific American Caucus, Congresswoman Jayapal, Co-Chair of the Congressional Progressive Caucus, Congressman Castro, Chair of the Congressional Hispanic Caucus, Congressman Clarke, representing the Congressional Black Caucus, and Chair of the CBC's Immigration Task Force. This moment is bigger than all of us, and the COVID-19 public health crisis has made it impossible to ignore the deep flaws in our economy, and it's highlighted how interdependent we all are. We can and must choose a different path for this country. And to overcome this crisis, we need bold, inclusive, and caring solutions. Solutions that include all families, including immigrants who are American in all but papers. We are all essential. And that's why we're here today, to demand that we are all included. With that, I would like to hand it off to Steve Choi, Executive Director of NYIC Action.
Thank you, Dorian. I'm Steve Choi. I'm the Executive Director of NYIC Action, and I'm lucky to be one of the three co-chairs of the nation's largest immigrant rights network, Firm Action. We are here today to talk about reality. And the reality is that millions of immigrants in America are on the front lines of this pandemic, helping keep all Americans safe and healthy. But they are bearing the brunt of the impacts, both in terms of dollars and cents, but also in their health and their very lives. Despite that, millions of immigrants have been left out in the cold from COVID relief, not able to get tested, being deprived of health care, shut out of basic cash relief, even though it is our communities who have been hit the hardest. Even though it is our families performing essential jobs, it's our leaders keeping people fed and healthy. And in New York, the state hardest hit by this pandemic, we've already lost millions of jobs, but we have also seen thousands of community members, our families, our brothers and sisters tragically pass away. In this pandemic, inequality really is life or death. But you know what else is the reality? That we are ready to fight back as a national movement of millions across this country. And while the forces of hate and intolerance are powerful, we've got some power too, do we not? We've got the power of the people, the power of our allies, and the power of our champions. So as Dorian mentioned, we're joined today by some of those champions. House leadership representing the Quad Caucus, the Congressional Hispanic Caucus, the Congressional Asian Pacific American Caucus, the Congressional Black Caucus, and the Congressional Progressive Caucus. And to those champions, thank you. Thank you for fighting with us in calling for all families, including immigrant families, to be included in the next round of COVID relief packages. We are in a critical moment with intense negotiations, and we must work together from the inside and the outside to fight for immigrants to be fully included in COVID relief in the final deal that is reached by Congress. And the thing that I want to emphasize is immigrants are essential. We are essential, and we've been essential long before this pandemic. But now we cannot be essential if we are excluded, because it's immigrants who are pulling America through this pandemic in meat packing plants, on farms, delivering food, cleaning infected facilities, opening grocery stores, and saving lives in hospitals. So today we're bringing a face to how vital we are, how essential we are, and you're going to hear directly from impacted immigrants from across the nation about why we're going to fight with everything we have so that our families and communities receive the support that they need. We are going to use all of our power, the people power that we've built as a network, as Firm, across this country for nothing less than the justice and the respect that our communities deserve. I'm joined today by my good friend and fellow co-chair, Lawrence Benito. He is the Executive Director of ICER Action. And now I'm going to pass it to Lawrence, who's going to introduce our speakers. Lawrence, take it home.
Thank you, Steve. Thank you, Dorian, for that energetic introduction. Again, Lawrence Benito with the Illinois Coalition for Immigrant and Refugee Rights Action, based in Chicago. Before we get started with our program, I wanted to just state a few housekeeping notes. For Spanish translation, please dial 301-715-8592. And the ID number is 979-544-71053. And then hit pound. It's on your screen as well. For Korean translation, we're asking you to dial 301-715-8592. And the meeting number for that is 983-533-07241. And then finally, we're asking you to join our movement by texting UNITY, that's UNITY, to 40649 to join our movement and to take action today. So thank you so much to our members of Congress, our participants from Firm Action, and to the audience for joining us today at the We Are Essential Town Hall. Thanks for being here virtually to engage in this important conversation. So let's move right into welcoming our first guests. We have with us today Lyra Kim with the National Korean American Service and Education Consortium, also known as NACASEC, and Congresswoman Judy Chu of California, and the chair of the Congressional Asian Pacific American Caucus. Thank you both for joining us today. Lyra, I invite you to share your story with us.
Thank you, Lawrence, and thank you to Firm Action, Congress members Chu, Castro, Clarke, and Jayapal for advocating for our communities. My name is Lyra Kim. 안녕하세요. 제 이름은 김이라이고요. I'm with an Asian American organization called NACASEC Action Fund, and I'm here to not just tell my story, but also my mom's story. My mom's name is Kyunghwa. She's 60 years old, and we've lived together in the United States for around 15 years now. We're both undocumented without DACA, so neither of us can receive any government aid, including stimulus checks. She's a single mom, doesn't receive any support from anyone, and for the last 15 years, she's been working at least 18 hours a day, every day, paying her taxes every year, not even getting to rest at home because she had to take care of me. And trust me, I was not an easy child to take care of. And with the pandemic going on, she's calling me a lot lately, asking me if I'm eating well, making sure I have enough masks, things like that. She doesn't want to make me worry about her, but I know she's eating less, not going to her doctor because she can't afford both rent and healthcare when she's lost her job as a result of the pandemic. And
Are we having technical difficulties with Lyra? Lyra, you're back.
Okay, cool. Where did it end?
Maybe you can just start.
That's where you lost your job. She lost her job as a result of the pandemic.
Thank you. And I don't know what to tell her, that she spent 15 years raising me by herself, being forced to choose between food, healthcare, and housing while paying taxes and making ends meet, just to be told that it's still not her turn or my turn to matter. A bill that doesn't include everyone is a bill that takes money off the backs of people like my mom and then tells them that they deserve to suffer. I want to be able to tell my mom that this government is one that believes that she deserves help just because she needs it, and that the people in it care about her survival. And the thing is, I know that all of us here care, but it's not just a matter of if we care. It's a matter of what we're willing to do to make sure that everyone is taken care of. I'm tired of fighting for me and my mom to be included, even among allies that still generalize undocumented immigrants as dreamers and DACA recipients. My mom didn't graduate college here, and I don't receive DACA, but we still matter. Undocumented immigrants aren't just a number. Every single one of us is someone's mother and child, and every single one of us deserves protection and care. So my question to all of the Congress members here is, what will you do if yet another bill passes that excludes people like me and my mom?
Thank you, Lyra. Representative Chu, I understand that you have a bill on these issues. What can we do to ensure the good policies that are in your bill are actually enacted in the final round, final package, in order to get real relief to people?
Well, first of all, let me say thank you, Lyra, for your courage in sharing your story and your mom's story. It moved me so much. So you have been so courageous in making sure that we all know what is going on, and that you reflect the experience of so many who are fighting against this injustice. It's so important that members of Congress know that millions of tax-paying individuals have been left out of the COVID-19 relief bills at a time when everyone all over the world is worried about their loved ones' health and safety. We have to do what we can to make sure that the economic pressures that every family is facing can be met. The fact that immigrants have been left out of all the earlier relief bills pains me to no end. That is why I have spoken up for the inclusion of immigrants every time I can. That is why CAPAC, our Congressional Asian Pacific Caucus, has told our leadership that this is a priority for us. And that is why in early April, I introduced the Coronavirus Immigrant Families Protection Act, HR 6437. This bill would make sure that immigrants who file taxes with an individual taxpayer identification number, or ITIN, are eligible for the $1,200 cash payments. Over 4 million immigrants pay taxes using an ITIN number and deserve these payments. In addition, mixed status families where some members might have a social security number are also not able to get these payments. Now, some states like California have announced that some relief will be available for these individuals and families, but it is not enough for people all across the country who are suffering. We have to make sure immigrants everywhere have access to the full payments that everyone who pays taxes is entitled to. My bill also addresses some of the other gaps in the CARES Act that left immigrants out. It would provide emergency Medicaid for the treatment and testing of COVID-19 to all immigrants, even if they have not been in the United States for 5 years. And it also halts the public charge rule so that immigrants are not fearful of seeking health care, and ensures that the CDC and other public health agencies make resources available in the most frequently encountered languages so that individuals who have limited English proficiency are aware of what benefits and resources are available to them. It's so imperative to the public health of our entire country that no populations are left out of receiving treatment, testing, and vaccinations when one is available. Finally, my bill also extends the expiring work authorizations and immigration statutes during the crisis so that no legal immigrant becomes undocumented during this time period. So, as the next CARES package is being debated in Congress, I'm working hard to make sure that the provisions of the Coronavirus Immigrant Families Protection Act are included, but we can't do it alone. We need leadership in both the House and the Senate, as well as members on the other side of the aisle, to hear from people like you on how economic recovery would be slowed even further if immigrants were left out of the relief packages. But I can assure you that members of Congress like me and like the others that are on this call will be pushing as hard as we can to make sure that immigrants get the help that they need.
Thank you, Congresswoman. Thank you, Lyra, for sharing your testimony with us today. Appreciate your time.
Thank you all.
So our next speakers, we will have two testimonies, one from Make the Road, New Jersey, and a leader from a member of One America Votes. So I'd like, and then they will be joined by Congresswoman Pramila Jayapal of Washington State and co-chair of the Congressional Progressive Caucus. Thank you all for joining us today. So I'd like to ask Maria Hernandez with Make the Road Action in New Jersey to share her story.
Hi, I want to start by thanking everyone who made the time to join us this afternoon. I am excited that we're having this conversation, especially with members of Congress like Representative Jayapal. My name is Maria Hernandez. I am a member of Make the Road, New Jersey. I am a DACA recipient and a rising junior at St. Peter's University in Jersey City. I am currently working on the front lines of this pandemic in one of the top 10 hardest hit cities in the second hardest hit state in the country. I process thousands of people every week who come to one of New Jersey's COVID testing drive-through centers. Every time I go to work, I am putting my family at risk, but I go because I have been part of this community for 15 years. This is my home, this community is my family, and I would do anything to see us through this pandemic. I would hope that if someone else was in my position to be able to serve like I am, that they would. That if my mother ever got sick, they would treat her with the same dignity and respect that I give to the thousands that drive through my testing site every week. Coming to grips with something that can change their lives and the lives of people they left back at home just a few blocks away. We take a lot of precautions at home. I shower and change my clothes right when I get there, but of course there's still a big risk that I'll bring the virus in and expose my mother who is undocumented and uninsured. That's why I decided to join today's call, because COVID doesn't care what my mother's immigration status is, and if she got sick, she needs to be able to access quality health care, period. In addition to the immediate need for access to health care, our immigrant community has also been left out of much needed federal assistance. Because of her status, my mother does not qualify for the CARES Act. Thankfully, I am still able to work, but I am not sure how much longer I will be able to do that, because I could lose my work authorization any day now. As a DACA recipient, it was hard to keep calm even before COVID hit. Every Monday at 10 a.m., I am anxiously awaiting the potential Supreme Court decision on the future of the DACA program. I am fortunate to still have a job and health insurance as a frontline worker. But as the end of June approaches and the Supreme Court decision becomes inevitable, I am not sure what the future will hold. I know I've jumped around a lot, from access to healthcare to all, to the CARES Act, to the Supreme Court decision on DACA. But that's what it's like to be in my head, to cycle through all the things that deeply affect the everyday for my family and me. We have a chance right now, though, to stand with all those essential and excluded. Congressmember Jayapal, will you ensure that 1, all 11 million undocumented people receive access to COVID testing and treatment? 2, all 11 million undocumented people are included in the upcoming stimulus bill? And 3, all work permits that expire this year, including DACA and TPS holders, are automatically renewed?
Maria, thank you so much for your testimony, but most of all for your work on the front lines. I can tell just from listening to you that you take that work as seriously and with tremendous dignity as we would want anybody to take you and your right to have all the same protections that we are offering to others. And you are absolutely right that the virus doesn't discriminate by status, and neither should we. So my first words are really of gratitude to you for everything you're doing on the front lines and for sharing with me your very, very powerful story. And you're right, it touched many issues because we don't live just in a world of what our immigration status is. We live in a world of what our status is, how we get to do the work, our economic conditions, and then of course our love for our family and your love for your mother and her safety is really clear. So
before you, sorry to interrupt you, but we can get Teresa to provide her testimony, and then I'll
got it. Sorry, Lawrence. I was so moved by Maria's testimony. I immediately started responding.
That's okay. So from your home state, we have a leader from One America Votes, a mother who wishes to be anonymous right now, but still wanted to take this opportunity to address the situation that she's in, and for you to respond to the issues that she's raising. Teresa?
Hello, I am Teresa, and I am a leader with One America Votes in Washington State, and I am an undocumented mother. I lived in Washington State for 8 years and 20 years in the United States of America. Undocumented people work hard, and we are resilient. We care about our families and communities. We always face inequities, but during the COVID-19 pandemic, we are experiencing a different level of oppression. Like all undocumented families, my family has been impacted by the coronavirus, and we do not have enough work hours or no work at all. Due to this loss of income, we could not fully pay April's rent or bills. And May's situation is even more difficult because past and recent bills must be paid. We do not have money to cover our responsibilities. Undocumented families are trying to survive during the pandemic, and it is frustrating, sad, and unfair that one more time we are not supported by the government, even we pay taxes every year. I have 2 DACA children. We are worried and waiting for the Supreme Court to decide the future of DACA. One of my children is a senior at the university. I want to celebrate his success, but I do not have money even to buy his cap and gown. He's extremely worried about his future after he graduates with a sociology degree in less than a month. My other child lives with his wife. He is the one who is supporting us financially right now when work and income has decreased. My health has been affected because of the level of stress that I am experiencing. How can I go to the doctor if I don't have money to pay one more bill? We need our allies to raise their voices and share with others that DACA and undocumented people are making an impact in this nation. We deserve to be supported. We are also on the front lines of this pandemic, just as citizens are. I am asking the member of Congress and Congresswoman Pramila Jayapal, how is Congress and Democrats using every bit of power you have to ensure undocumented immigrants are included in the upcoming stimulus packages? And how are you pushing to make sure that DACA permits are automatically extended during this time of crisis? Thank you.
Thank you, Teresa. Congressman, sorry I cut you off there. I wanted to make sure that you had the full testimonies of both Maria and Teresa. And, just in case you lost your train of thought, both of them wanted to know, what we can do to ensure that all immigrants will gain access to testing and treatment, are included in the economic supports to the crisis, and also the need for work permits to be automatically renewed during this pandemic. If you can share.
Thanks, Lawrence. Thanks for all of your work. And also to Teresa, thank you for sharing your story. I got to thank Maria. I feel like I need to do the same with you for your courage, your resilience, and your work. And of course, One America is near and dear to my heart as the founder of that organization and a member of FIRM for so many years. So I feel like I'm still on outside organizing with you. I'm just here in Congress now. To all of the questions on DACA and what we're doing there, we are pushing very hard. We understand that DACA and the Supreme Court decision could come down any day. I was just speaking to a number of people about what the possibility would be of our trying to ensure that at least our DACA recipients who are on the front lines, whether as undocumented farm workers or as DACA recipients, or whatever capacity they may be providing essential services, if we could get them to have citizenship or path to citizenship, because I think that it's very hypocritical to say that we think these workers are essential and then at the same time talk about deporting people from this country. So we will continue to push for that. We sent a letter to McConnell to have the Senate take up a vote on the American Dream and Promise Act. I don't know that that is happening, but I just want you to know we are pushing very, very hard. As you have noted, many of our COVID packages have excluded many categories of immigrants, and it's not right because the virus doesn't discriminate based on status, and neither should we. Even if you didn't agree with our moral perspective that everybody deserves treatment and testing and the ability to be safe in their workplaces or stay home if they can't be, the reality is that everyone should care, because our goal is to beat the virus and any spread of that virus, whether it is in a workplace of an essential worker right now, or whether it's in a warehouse, or whether it is in the fields, will affect everybody's public health. So Judy Chu, as you heard, has a bill. I am a co-sponsor of that bill. We are going to push very hard. But as she said, we have to get Republicans to support this and to push for it. Democrats only control one chamber. And so we are counting on the work of all of our coalition partners and those of us on the inside to organize more and to try to get that inclusion in the next package and to force the president to pass this. I also just wanted to mention on income, because Teresa, you talked about this. I have a Paycheck Guarantee Act that would ensure grants to businesses, nonprofits, other employers, individual domestic workers, essential workers, gig workers, the ability to continue to get a paycheck through this crisis. And so that is a very important proposal that I am pushing, and it would include a lot of immigrants across the board in that proposal. And so I hope that I have some success in moving that forward, because I understand that you have not been able to get an income and that you're relying on your child, and I can hear the emotion in your voice. And I think so many people are facing a second and third month without a paycheck, and with that, the inability to provide for their families. And so I recognize that the economic devastation is enormous, and that is on top of the public health devastation that we are facing. So we will continue to push for all of these things. We have been doing that, but we need to find some new ways to organize Republican allies to stand up against Stephen Miller and against President Trump, and force them to recognize the morality and the human rights and the dignity of all of our immigrants who are helping our economy and our country and our communities to thrive. Thank you both so much for your testimonies, and I hope that we can continue to work together and continue to build our power. And it's really wonderful to see the One America Votes logo up there, even if I can't see your face. So thank you both so much, Maria and Teresa.
Thank you, Congresswoman. Appreciate your leadership, and good to see a former colleague now in Congress fighting the fight on the inside. Appreciate your time today. Maria and Teresa, thank you very much for your testimony, and appreciate the leadership that you're providing in your communities each day. Thank you.
Thank you, Lawrence.
So now we're going to move on to our next panel. We are going to invite Hazel Ramos with Chirla Action Fund and Ixa Ortega Fuentes with the Workers Defense Fund. They will be joined by Congressman Joaquin Castro of Texas and chair of the Congressional Hispanic Caucus. Welcome to all of you. Hazel, if you would like to begin to share your story. Is Hazel on? There you go. Are you on, Hazel? Can you hear us? Yes.
Okay.
Go for it.
Good morning, everyone. Thank you for giving me the space to share my story. I am glad that leaders of so many caucuses are joining us today and looking forward to hearing your responses. My name is Hazel Ramos, and I come from a mixed status family. My parents are undocumented, and my two younger siblings are U.S. citizens. My family and I are Californians and residents since 2004. I am currently a second-year student studying sociology and labor and workplace studies at UCLA. I'm co-chair of a student organization called Ideas at UCLA, an advocacy group for the undocumented community. I'm also a proud Chirla and California Dream Network member who has participated in the California primaries Get Out the Vote efforts in Los Angeles, Koreatown, by knocking on doors and encouraging low propensity voters to exercise their civic duty. As an immigrant advocate, my civic duty today is to express the daunting experience the undocumented community is currently facing due to COVID-19 with my testimony. Unfortunately, at the institutional level, undocumented students are not provided with the financial resources to address the immediate need during this pandemic. In addition to the issues undocumented folks already face, COVID-19 has exacerbated the already existing prejudice against the undocumented community. For my family, COVID-19 has meant a huge financial loss. My dad works relentlessly to provide for our family as a day laborer, but due to COVID-19, he lost his job and can no longer afford to pay his bills and continue supporting my family. Ironically, the stimulus check is intended to help those in need during COVID-19. And yet, one of the most vulnerable communities was not deemed worthy of a check despite all their labor and societal contributions to the United States. The distress my family feels from trying to figure out how to feed a family of 5, how to balance my education, and how to pay bills are the struggles that resemble many undocumented families across the country right now. No family should ever have to experience this because the government does not provide the resources to mitigate the effects during a pandemic, which is why it's essential to provide undocumented folks with cash payments and even further, a permanent solution with a pathway to citizenship for the 11 million immigrants. That of course includes our DACA community that is currently waiting for a Supreme Court decision. These legislations will help the immigrant community not only survive, but thrive. Which brings me to my question for you, Representative Castro. As a progressive congressman for the Congressional Hispanic Caucus, what are you and the caucus doing within your power to ensure that undocumented and mixed status families are included in the next COVID-19 relief package? While everything has stopped, immigration enforcement continues. Tell us what actions will be taken to stop deportations during this pandemic, and what can we do as a community to support these efforts?
Thank you, Hazel. Before we ask the congressman to respond, we're going to also hear testimony from ICSA, and I believe that Laura Perez Boston will be translating for her, and they'll go back and forth with translation. So ICSA, would you please share your story with us?
Thank you. Gracias a Phil por la invitación a participar en este foro. Mi nombre es Ixa Ortega, soy miembro de Defensa Laboral, una organización con base que constituye poder popular, poder económico y poder político en Texas.
Thank you to FIRM for hosting this forum. My name is Ixa Ortega. I'm a member of Workers' Defense. Workers' Defense is a membership-based organization that builds people power, economic power, and political power in Texas.
Tenemos presencia en Houston, Dallas y Austin. Yo vivo en Houston con mi esposo y nuestros 2 hijos. Perdí mi trabajo debido a la pandemia del COVID-19.
The organization organizes in Houston, Dallas, and Austin. I live in Houston with my husband and 2 kids. I lost my job due to the COVID-19 pandemic.
Mi esposo trabaja en construcción y todavía tiene su trabajo, pero no tiene las protecciones necesarias para cuidar su salud y la nuestra. No le proporcionan tapabocas, guantes y ni siquiera tienen un lugar donde lavarse las manos.
My husband is still working in construction, but his employer does not provide him with what is necessary to protect his health and our health. He's not given a face mask or gloves or even a place to wash his hands.
Él se arriesga porque no tiene la opción de quedarse en casa. No recibimos el dinero del gobierno, del estímulo por ser inmigrantes.
He puts himself at risk because he doesn't have the option to stay at home. We're not eligible for the federal stimulus money because we are immigrants.
Según los trabajadores de construcción son esenciales, pero los políticos y los empleadores nos tratan como desechables.
Supposedly, construction workers are essential, but many politicians and employers treat them like they are disposable.
Nuestras vidas y nuestras familias son importantes y merecemos una economía que nos proteja y nos permita salir adelante.
Our lives and our families matter, and we deserve an economy that protects us and allows us to thrive.
La experiencia de mi familia no es única. Son más de 2.6 millones de residentes en Texas que tienen un familiar que no cuenta con documentos.
My family's experience is not unique. There's more than 2.6 million residents in Texas that live with family members that do not have documents.
Quiero cerrar este mensaje diciéndoles que no nos dejen fuera de las ayudas. Nosotros también somos seres humanos. Nosotros, los inmigrantes, exigimos de nuestros oficiales electos lo que necesitamos y merecemos.
I want to close with this message. Don't leave us out of the relief. We too are human beings. Immigrants are demanding what we need and deserve from our elected officials.
Un rescate económico del pueblo para todos, protecciones laborales como de salud, seguridad y derecho del desempleo, y también definitivamente un paro total a las redadas y deportaciones por parte de migración.
A people's bailout for everyone, labor protections like safety and health, and the right to unemployment, and definitely a moratorium on immigration raids and deportations.
Congresista Castro, ¿podemos contar con usted? Gracias.
Congressman Castro, can we count on you? Thank you.
Yes. You want me to answer now, or do you have more testimonials? Or
No, I just wanted to say thank you to our speakers, Hazel from Real Action Fund, Ika from Workers Defense, and others help with the translation. Representative Castro, I don't know if you heard all the testimony, but I can reiterate the ask here. It's clear after a couple of months that COVID-19 and the economic downturn is disproportionately impacting communities of color. Can you please speak to the racial disparities in policies that are leading to different outcomes and how we can work together to ensure that Hazel, Ixa, and their families are able to access healthcare without fear and relief measures like hazard pay without risking their life? Congressman.
Sure. Well, first, thank you all for having me on, and thank you for the testimonials and the firsthand accounts of what's going on in your own lives, and both the public health and the financial devastation that this has created in our communities. Of course, I chair the Congressional Hispanic Caucus this term, which is 38 members large in the U.S. Congress, and also represent the great city of San Antonio in the House of Representatives. And so this has been, on the public health side, we fought to create about $1 billion fund that could be used by folks regardless of immigration status, so people could get tested, for example, for the coronavirus. There needs to be more money put into that fund, additional money, because I believe that everybody should be able to get not only tested, but also treated if they're infected. On the economic side, it's also not only been a public health emergency, but a financial emergency for so many families. In fact, the reporting in the last few days, the surveys have shown that the Latino community is impacted the most of all the communities in the United States so far financially. And so a few things there, you know, we've been fighting since the beginning. We were fighting to use ITIN numbers, individual tax identification numbers, as the standard for the Treasury to distribute funds to workers, to folks in American society. Of course, in the final compromise between the House and the Senate, that's not what happened. Instead, Social Security numbers were used. So that means that there are millions of workers who use ITIN numbers who are also paying taxes that are not getting financial relief. And as y'all know, the injustice is greater than that, because not only are those individual workers not getting relief, but even if they're married to U.S. citizen spouses and have U.S. citizen kids, the whole family is not getting any relief. So that grave injustice needs to be corrected. We've been putting a lot of pressure on the administration to correct it. The Treasury Department finally gave a comment that for the mixed status families, for example, that the U.S. citizen spouses and the children would be able to get funds, but that the spouse would have to file separately. But that means that for people that already filed, that could be next year when they file separately, and people need the money right now. So we're pressing the Congress in this next round, this CARES 2.0 package, to fix what the administration refuses to fix. So we've been pressing that very hard. I also believe that there should be hazard pay for workers who have been going out and risking their own health, the sanitation workers, the meat packing plant workers, the farm workers, the grocery store clerks, the folks that have not had the luxury, as those of us in Congress have, of staying at home and working. They, I believe, should get hazard pay from their government and or from their company for risking their own health during this pandemic on behalf of all Americans. And so I wholeheartedly support those things. I want to send to y'all, I'm going to ask Alma Acosta, who's the executive director of the Congressional Hispanic Caucus, to send to everybody the list. I think it's about 10 or 12 pages of things that we asked our Democratic leadership to fight for on behalf of the Latino community. That includes the undocumented community in the United States, because we've been pushing these things fairly hard.
Representative Castro, if I could ask a follow-up question.
Yeah.
Ixa and Hazel also spoke powerfully about the threat of deportation in this moment of crisis for so many of our community. How do we support each other in the call to suspend enforcement and deportation?
Yeah, that's another thing that we wholeheartedly agree that we've been pushing for, is especially for these essential workers, a suspension of deportation. You think about the irony of asking people, farm workers, for example, or these meatpacking plant workers, some of whom are undocumented. You've now deemed them as part of the critical infrastructure of the United States, but at the same time, you have a president who politically keeps bashing them and wants to deport as many as possible. We had, early on during the pandemic when it started, we had asked, well, first we had suggested to ICE that they change their enforcement and removal posture. And they actually responded saying that their intention was to only go after criminals. And again, I can forward you that response so y'all can see for yourselves, was to only go after criminals, but that they were going to basically be selective about enforcement. So, we're on the same page there. We've been pushing them. There has been an internal fight between the ICE director and the larger administration on the policies during the pandemic. A lot of it, I'm detouring a little bit, but I think it's important. A lot of it has to do also with the detention centers and the fact that many folks, I'm sure all of you and us, we've been pushing for folks to be released to family members in the United States during this pandemic, because these ICE detention centers, just like nursing homes, just like cruise ships, just like that naval ship, these are places where the virus spreads very quickly and powerfully. And as you probably saw in the last few days, there was a death near San Diego at one of these ICE detention facilities. So we've kind of been battling with ICE on many different fronts here, and we'll keep it up.
Thank you, Congressman. Appreciate your time with us today, and thank you to Hazel and Ixa for sharing your stories. Appreciate it. Thank you for your time. So now we're going to move on to our next panel. Last but not least, we have Jubril Abdelhakim with NYIC Action, and Congresswoman Yvette Clarke of New York with the Congressional Black Caucus, where she chairs the CBC's Immigration Task Force. Jubril, thank you for joining us today, and invite you to share your story with us.
Thank you very much. Good afternoon. My name is Jubril Abdelhakim. I'm actually from Nigeria. I came into this country in 2017, precisely on the 13th June 2017. I'm a graduate of mathematics and statistics back in Nigeria. I had my first interaction with ICE almost exactly 2 years ago, on the 15th March 2018. I'd come from Queens, New York, to visit a friend in Buffalo, and on that fateful day, we were intercepted by ICE agents at a traffic stop. These officers were so hostile in the way and manner the arrest was handled. This is only a tiny fragment of what others like myself experienced in the hands of ICE. ICE has become a tool used by administration to carry out its political agenda in the so-called immigration reforms. ICE is now seen to conduct its business with officials that are fierce, unprofessional, and in some cases, acting in a totally irresponsible manner that goes beyond the aims and objectives of the founders. In fact, ICE has succeeded in adding to the trauma being faced by immigrants rather than alleviating their sufferings. The day I encountered ICE officials remained a stigma in my life. I was humiliated, dehumanized, and shackled like a criminal. Upon being taken into custody, I was rushed immediately to the hospital, battling for my blood pressure to be brought under control. Immigrants go through a lot of trauma right from the day they step into the facility until the day they are either deported or released. As a result of being picked by ICE at a traffic stop, I was detained in the Buffalo Federal Detention Facility in Batavia for 25 months, without access to a lawyer for a majority of that time. During my imprisonment, I saw firsthand the horrors of immigration detention. The units in the facility were usually congested, giving little or no room for proper care and feeding. It was almost impossible to have a clear head and sound mind while in the facility. I personally saw and intervened when a fellow detainee attempted suicide, but rather than canceling the detainee, he was taken to a lockdown room as a punishment for attempting to take his life. The recent coronavirus pandemic has made it worse. There is no way the social distancing measure can be met as stipulated by the CDC guidelines. Facilities do not have capacities for ventilators. In the facility I was just recently released from, the number of detainees already infected has risen to 49. After spending 25 months at the detention facility in Batavia and going through all the stages of attempting to secure a bond and being denied every time, despite the fact that I had no criminal record, I was finally released in April due to a class action lawsuit concerning the health of detainees. Congresswoman Clarke, I have seen firsthand the devastating and deadly impact immigration enforcement and detention is having on immigrants and their families. How will you work to stop the abuses by this administration and free everyone still trapped in the immigration detention? Thank you.
Jabril, thank you for your powerful testimony. Representative Clarke, welcome. Jabril's firsthand account truly underscores the conditions in immigrant detention. Can you please share with us how we can work together to hold this administration accountable and ensure critical protection and release for those who are detained in the next recovery bill?
Let me first of all thank you, Lawrence, for inviting me to be a part of this conversation. And Jabril, let me thank you for your testimony. You know, I'm a daughter of 2 immigrants to the United States of America. My parents came to the US in the 1950s. I was born in the United States. And had my parents experienced a fraction of what you've experienced and so many more of my neighbors, my friends, my relatives, you know, I doubt I would be sitting here as a member of the House of Representatives speaking to you today, fighting on the front lines, because I understand intimately what it is to be dehumanized, to be treated as though you're here to take something as opposed to add something. And, you know, right now the battle in the House of Representatives is a fight for human dignity on multiple levels. Many of us in the Democratic Caucus recognize that our immigrant population are an invaluable resource to us here, as well as to their families in their homes of origin. As productive Americans, they're able to serve on our front lines where they are right now. They're able to earn a living and live the American dream in a way in which they then are able to even give back to the homes from whence they've come, adding in both environments. But we have a xenophobic, racist man in the White House, Donald Trump. And that has changed the trajectory of where we need to be in the 21st century on its head. Our responsibility right now during this COVID crisis is to fight for every living soul to receive human dignity. The fact that the first CARES Act did not provide benefits, did not provide any lifeline to the same essential workforce that is putting their life on the line to make sure that the rest of those who are able to stay at home can live in dignity, indicates to us that we have, as a nation, got to step up and do what is right. That means that we have got to look at our homeland security protocols. That's an agency that has truly gone rogue. When I say gone rogue, they are following the edicts of a xenophobe as opposed to looking out for what is in the best interest of the American experiment, if you will. Now we're dealing with food supply, we're dealing with lives on the line. And this is not the time for us to be xenophobic. This is time for us to be bold, outspoken. And I can tell you that the people of the 9th District of New York will expect nothing less than this next CARES Act, extending its reach into our undocumented population, making sure that they receive testing, making sure that their health is okay, making sure that they have access to resources. But beyond that, we have got to shackle ICE. We have got to make it clear and draw a straight distinction from the spread of infection in our communities to the spread of infection into the detainment camps, to the spread of infection from individuals who are deported to other parts of the world, of our hemisphere, where public health infrastructures are fragile. We've got to make that case, and many of us, including myself, yours truly, are making that case each and every day that we speak in the House of Representatives. I believe my colleagues in the House of Representatives get that. It's the Senate, and to be quite frank with you, it is the Republican Party. So we've got to stand up, we've got to speak out, we've got to push the envelope, we've got to be bold, because indeed all of our lives are at stake.
Thank you, Congresswoman. Thank you for your remarks. Thank you for your leadership in the House of Representatives. We look forward to working with you in this next round as we continue to fight for dignity for all our people. Jabril, thank you for your testimony. Appreciate you sharing your experiences in detention. Thank you for engaging with us today. So this concludes the question and answer part of our We Are Essential Town Hall. I want to thank our Firm Action family and members who provided testimony today. Thank you to Congressman Castro, Congresswoman Chu, Congresswoman Clarke, Congresswoman Jayapal for joining us today and leading in Congress to ensure all our families are included in reliefs. So as we bring this to a close, I want to make sure that people are clear about what our call to action is. This is just the beginning of our push for immigrant inclusion. What happens next will depend on all of you watching today. We're going to take our fight to our communities, and we need your help to build as big and strong a movement in this hard time as we can. So I have 3 actions that I'm going to ask for you and your friends to take today. First, join our movement. Text UNITY, UNITY, to 40649. That's again, UNITY, UNITY, to 40649. And you'll get the updates and be connected to our campaign. Second, join a firm action organization. We're all over the country, leading the fights at the local, state, and federal levels for immigrant inclusion. Find an organization near you. And then lastly, third, call your member of Congress, tweet at them to ask them, demand that they join with these members of Congress with us today in fighting for our communities. We're in a critical moment with bipartisan negotiations, and we must work together to fight for immigrants to be fully included in COVID relief. This pandemic has impacted communities of color and immigrants the hardest, and we cannot be essential if we are excluded. So we need everyone watching today to take action. So again, text our line, join a local organization, and contact your member of Congress. Thank you so much for joining us today, and have a good day, everyone.